You're ready to go, boss.
I see him. Or just wait for him to connect.
Sure.
There he is. There he is. Elliot, can you hear us?
Yes, I can.
There we go. All
Great
right,
sound.
cool. Thank you.
Have to update the microphone.
All right, I'm gonna call the meeting to order. No changes to the agenda. In addition to the approval of the August 9th meetings, sorry. In addition to the approval of the August board meetings, we also have a correction to the July meeting minutes. Is it the July meeting minutes?
Yes.
Yes, July meeting minutes. There was a typo in that letter, so, or in the meeting minutes. So instead of saying June regular meeting, it says May regular meeting. So we have to switch it to June 2024. So if I may have a motion to approve both the August meeting minutes as well as the amended July meeting minutes, that would be fabulous.
I move that we accept the July and amended minutes and the August minutes as written.
Second.
All right, all those in favor say aye.
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 I think motion passes. We'll move, I'm assuming there's nobody in the thing for public
There's
comment.
no public comment online. The young lady that was in here, I don't really think she actually wanted to provide public comment. I think she
Oh.
actually had a question about starting a new business.
Oh, gotcha. Okay. Well,
Am I right?
Thank
Okay.
you for facilitating that. Everybody plays different roles, right? Or multiple roles.
Yeah.
All right, well, first of all, we want to welcome our new board member, Dan Caprio. We're really excited to have him here, and I don't know if you want to take a moment to introduce yourself, tell
Sure.
people about you.
Sure. Well, really excited, honored to be here. We're new to, I was saying, new to Jefferson County in the last 18 months. My background, a long career in DC, including Capitol Hill, but mostly technology policy. Was a senior executive in government at the Federal Trade Commission and the Department of Commerce. But we have when I was at Commerce, I was acting assistant secretary for technology policy and had a chance to work on a wide array of issues, including, you all remember Project BioShield, sort of the early days of post 9/11, what we're going to do with vaccines and those kinds of things. But I've started a couple of companies, but my current company, the Providence Group, we do a lot of work with healthcare clients. So I have a real interest and passion for public health, and I look forward to working with all of you and serving the citizens of Jefferson County. So just proud to be here.
If everybody, when you have your respective reports, you can just introduce yourself to Dan, so if you haven't had a chance to already talk with him, I think that will be helpful in his learning curve. Next item is election of officers. So we've been delaying that, waiting for the new board person to be seated. So welcome. Glad you're here, so we can move on with that. Is there a motion?
I move that we nominate Karen as our president. Do we do one at a time?
I think so. Do one at a time.
I second that.
Any discussion? All right, all those in favor say aye.
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 I didn't
Opposed?
get sworn in.
Oh,
So
you
I
haven't been
was-
sworn in?
I thought I could do it here.
Oh,
I
okay.
misunderstood.
Gotcha. Yeah, over at the clerk's office. Okay,
That's
gotcha.
my clerk's office, but I'll take care of that for next week.
No worries. Okay, thank you. The motion passes.
Did we have any of Elliot?
Oh, sorry.
I'm sorry.
Elliot, did you vote?
Yeah, I said aye.
Okay.
Yeah, so fine.
Good.
I'd like to make a motion to nominate Brandon for vice chair. Is that the right chair? Vice chair of the Board of Health.
I second that motion.
All right, any discussion? All those in favor say aye. Aye. Those opposed? Elliot? I know I didn't know that one.
What's that?
Are you aye or nay for Brady?
Oh, I said aye.
Oh, okay, sorry, we're not hearing you very well.
Okay.
All right, then, thank you all very much, and we'll continue
Doing what
continue
we're doing,
business,
yeah.
keep on keeping on, all right. We'll move over to new business, Cox Holiday, call sign Charlie.
Good morning, everyone. Introducing myself, I'm Charlie Heilman from Cox Holiday Young, and your contracted accountant. We have 3 reports to go over: the June, finalized June, the July 2024, so that's the new fiscal year, and then the preliminary August. If it's okay, I'm just do a high level on June, since we've gone over it 3 times. It hasn't changed much. First, we're gonna go over the reserve requirements. You have a reconciled bank balance of $483,000. That is in compliance with reserve requirements in excess of $51,000.
Which month are we looking at now?
June 30, end of the fiscal year.
Okay.
We haven't voted on those yet, just because we were wanting to wait till the final, yeah.
Fiscal year to date, there was a deficit of about $33,500, and that's directly related to the renovations. Excluding that, it would have been a break-even year. Accounts receivable, we're at $358,000. 267 of that is related to West Virginia Treasury, and we're going to see that spike a little bit next month, and then it's going to dip back down. Sort of preview of things that come. Any questions on the June 2024 financials?
You'll have questions for me, I'm sure.
I think we want to just wait to see all the receivables come in, so if we're in sort of where we're supposed to be, then I'd like to make a motion to accept.
I second.
June. Any discussion? All right, hearing none, all those in favor say aye.
Aye.
All right, the motion passes, so we've got June done, on to July.
July 2024, new fiscal year. So we're 8.3% through the year, and we'll kind of cover that later on. So we have a bank balance of $435,000. We're in compliance with reserve requirements by a little over $3,000.
That's July. Go ahead.
Financial summary. This is July and fiscal year to date. This is the first month of the year. Revenue of approximately $141,000. We're going to reduce that by salaries and wages of $103,000 and operating expenses of $7,700, leaving us a surplus for July and fiscal year to date of almost $30,000. Comparing that to the budget, we are on target. Revenues are on target, salaries and wages are on target, and operating expenses are actually 5% below budget. Accounts receivable, $430,000. And again, I said to expect a spike from West Virginia, 347,000 of that is directly related to West Virginia Treasury. That's 81% of the receivable balance. Any questions on July 2024?
Starting off in the right direction.
Yeah,
The only question I would have is, how does that compare year over year?
say that again.
Your review.
Year over-
Where were we at this point last
Oh,
year?
I'm sorry.
Yeah, you have that in the
Yeah,
report.
Because that's the
So-
first month, this is the first month of the new fiscal year, July.
Yes,
So I
So,
was just curious as to, how it compares to last year.
absolutely. So, net income last year was $34,600 roughly, and we're at $30,000.
Okay,
It's only $4,500 difference.
okay. Yeah, that's very reassuring. Thank you.
So if no other questions, is there a motion to accept the July?
I move we accept the July financials.
Second? Second. Any discussion? All those in favor of accepting the July financials as is, please say aye.
Aye.
Right, motion passes. Move on to August.
August preliminary, we are only 17% through the year. So a bank balance of $573,600. In compliance with reserve requirements in excess of $156,000. Financial summary, August performance alone, revenue, $102,000. We're gonna reduce that by salaries and wages of $96,000 and operating expenses of $8,000, leaving us a deficit for the month of August of a little over $1,000. Fiscal year to date, revenue, $243,000, salaries and wages, $200,000, and then operating expenses of $15,400. Leaves a surplus through August 2024 of almost $29,000. In comparison to last year, we were at a deficit of $60,000. Compared to budget, revenue is 1% below budget. Salaries and wages, 1% below budget, and operating expenses, 11% below budget. That makes me think that there are still expenses that need to be reported. So again, this is preliminary. So I do expect the expenses to go up.
So that means then the deficit will increase as well then.
Correct, for the month of
Yes.
August.
in the month of
But there
August.
might also be revenue to offset some of that that hasn't been looked at,
Got it.
especially in and around medical billing.
Got it.
Exactly. Accounts receivable, $287,600. And West Virginia Treasury is $180,000 of that, 63% of the receivable balance. So that went down quite a bit, $150,000.
That average days to pay is 45.36 across the 3 months. I'm just wondering if that's like
Yeah.
a calc issue.
It is. So actually Amber and I discussed that. So every month there's a report to pull, and you have to pull it like at the month end, and it doesn't, that's the only time it changes. Like you can't change the dates. And
I
QuickBooks,
understand
yeah,
what you're talking about.
yeah, and
But
so
you gotta
Amber
grab it
pulled the
that day,
reports,
yeah.
and she changed the dates, but the calculation never changed. But there's usually very little variance. Anyway, yeah.
Okay.
But we actually discussed that, and you'll see that shift from that one.
Okay, thank you.
Any questions for Charlie on August? We'll wait on the final report next month, right, for August, so we will move on. When does the audit happen? for the previous
Usually November.
November?
And we were clean last year. I suspect we'll be clean again this year.
Yeah.
Mhm.
Okay. Great.
Thank you all for your time.
Thanks, Charlie.
Thank you.
Thank you.
So you will be back again someday.
Yeah, I'll be here for a while, and helping
Not ready to do
Amber
like
out for
Charlie
a while.
There was no vote to let you go.
Oh, okay.
Reminding you.
I'll just wait until that vote happens.
Yeah, exactly. So
You don't want to see the outcome of that. vote.
Yeah, it'll be half past never.
Thank you, Charlie.
Appreciate you guys.
Yeah, take care.
See ya. All right, we're gonna move on to new business, or sorry, we're already in new business. I guess the agency, well, we have a short agenda this week. Agency activity report.
So Brandon is at a tabletop exercise with the county. So he is, our threat preparedness coordinator is not here today. He was here this morning, but it's at 9, right over there at the truck preparedness over there. So quickly, we discussed that we would have active shooter training provided by the Jefferson County Sheriff's Office. Deputy Sheriff did come in and trained us again. We do that, try to do that every year to every other year, and it was actually, I got killed, so I was told I'm not supposed to go out and try to help people. So I'll try not to do that next time.
I'm sorry to hear that.
Yeah, I lived afterwards. It was amazing. So, and then just basic for preparedness tasks, trainings, things like that, and making sure that the staff is up to date on all their preparedness trainings. And he's done a really great job of that. So,
I attended a point of dispensation training in Bridgeport, not San Diego. 2-day training, and that would be if there's an emergency need to distribute medication to the population, how would that roll out? So it's kind of like doing mass vaccinations, except it's not over a 3-month period. It's you got 48
Sort of like what they're
hours,
doing with
24 hours.
The
to do
polio
it.
stuff in Gaza.
Right. So, but like something like anthrax, you need to. So really.
I'm not hearing Dr. Reedy
I'm
too well.
sorry. So point of dispensation training, that has to do with if you suddenly had to distribute medication to the entire population or a segment of it, how would you suddenly do that? And the one scenario that's often talked about is anthrax, because that has happened, not in huge amounts, but you would need to get antibiotics to people very quickly, and things like that are stockpiled. You have to ask for it through the right channels, and then you have to have a network of people that can, how you recruit people to come in and get their stuff, how you record who got it, how you give them the instructions, dispense it. You know, if you have people allergic to that one, how do you give another one? So it's like the COVID vaccinations, except you don't have 3 months to do it. You have 36 hours or something like that. So it's a daunting scenario.
How do you get the medication that quickly?
So that would be something that would be stockpiled from the national stockpile,
Mhm.
and you know it. And that's a big question: is when will it arrive? It's gonna be driven
Is someone
from-
gonna answer the phone when you call for it?
Yeah, so there are all these realities, and you can sit in a room and plan it, but you know, for us, is it going to come from Charleston? Which is it going to be driven down? Is it going to be flown down? Can we get it from Baltimore? Can we, you know?
Mhm.
So all these little things that everything happens different in emergency. You know, so there are lots of things to consider. We're going to need to spend more time. We have been in discussions with someone at the border protection group about doing having them as what's called a closed pod, where they would be responsible for doing the distribution for all of their staff and possibly and the families of the staff. So having agencies in the area that will be responsible, that we then bring it to them, and they have a responsibility to take care of it.
Who coordinated the session? Is it federal?
So this was a
state?
federal one. It's actually out of Texas, but it's a very good session.
I wonder what prompted the contemplation of this kind of exercise.
This is ongoing. This is
Oh,
an
okay.
ongoing thing for decades.
Oh, okay.
So no one's
but-
sounding the alarms.
No,
It's fine, it's fine,
Yeah.
it's fine.
Yeah,
just curious.
we have the point of
It's a good question,
dispensation memorandum of agreement going back well over a decade with different, but unfortunately, the people doing it change.
Right.
So we may have an agreement, but there's no one there, you know, it's hard to keep things active when you never do
Right.
which is a nice thing, but
It's kind of the point of the exercise.
yeah, but that's one of our big challenges is to do this stuff. That's gonna be something Brandon's increasingly involved in, and that's why the Bureau has made that one of the positions we have to have.
Talked about that last year, I believe, that the threat preparedness coordinator position was not a required position for the health department. Now it is a requirement under state law, so we want to make sure that I have someone in that position that can handle it, and he's done a great job. So,
Well, and I mentioned, I worked on this 20 years ago when I was at the Department of Commerce. But so one of the things the federal government and state government too, but continuity of operations, like you said, that just goes on and on and on and on. The people change, but the plans are in place. It's to Karen's point, finding someone to answer the phone, or how do you get it from Charleston, you get it, where do you get it from, or where is it pre-positioned? Especially with anthrax, that's the real hard part, because you just don't have, you gotta work that out in advance, because you don't have the time to, you gotta have that line of communication open and be on it right away.
So there are all sorts of different scenarios that get discussed, like you have school bus drivers going to every house and this, dispensing it. You have shut-ins, how do they get it? So it's scary to think about it, but and that raises the need for volunteers, which we were fortunate we had a lot of volunteers, but keeping a volunteer group together is difficult because you have to have activities for them to do. So that's a big focus for the coming year also is to try and reinvigorate our volunteer group.
Can I ask another question though about this training? When I was involved in this 20 years ago, a lot of it, and this is not so much anthrax, but two things. One is a lot of it depends on the continuity of operations, but sort of which direction the wind blows. So if you're downhill, downwind from DC, that's a problem like in Annapolis. But the other problem, it seems like I recall from back then, is that a lot of people, the evacuation plan was to come out this way. So that's another thing that you've got citizens of Jefferson County, but a lot of people, and I think, I'm not sure a lot of people have thought about this as much in the last decade as they did after 9/11, but a lot of people from DC would come this way. I don't know if that was on the table, but it's like the population is going to swell.
So not at this, we do have the Emergency Operations Center, which is right in this today. They're having an exercise that will actually involve a bit of a pod, but we have a local emergency planning committee, which meets monthly. It was pretty active, and then there's also a counterterrorism committee.
Right.
Okay. They discuss some of this. This county is part of the DC metropolitan area, so we are a little bit involved in their plans, though not greatly. But it's scary to think if suddenly this population swelled to 350,000, then we have all our environmental and food safety and sanitation issues. It's so, but it's good to consider it so that we're not as overwhelmed. At least don't have shock. And for the first 72 hours, we're on our own.
Interesting. Environmental.
So good morning, I'm Alexis from Environmental, the sanitary supervisor. So just to give you an overview of environmental, Dan. We have 4 working sanitarians. We also have environmental resource associate and an office assistant, as well as myself, and I am a certified registered environmental health specialist through the month review. So we have a couple of things. One, I wanted to point out that I did condense the activity report, just for the sake of making it on one page and a little bit easier. None of the numbers were reviewed. I just essentially combined some of those. If you want any of those numbers that were on the previous, activity report, please let me know. I'll put those back in. But just for the sake of making it a little bit easier to glance at those numbers. The total for the month was 117 site visits. It's, a lot of those were temporaries. We had the Jefferson County Fair. We had a good bit of activity there, a lot of food vendor inspections. Everything went well. One of the things I did want to say is we did have one enforcement related closure. So we do have a food facility that was closed due to some ongoing health issues that are very long standing. Those complaints that we have under the food inspection total, 5 out of those 7 last month were for this one particular facility. Those were related to pests and vectors. So we were really trying to work with this facility. The first time we were in there was actually back in July. We noted it on our inspection. We said, look, we don't want to close you. We want to give you the time to address this. Unfortunately, it wasn't addressed, and obviously the public is, asking us to do something. So we responded. We closed them according to West Virginia State Code, creating a public health nuisance, which is what the state directed me to do. I let them know as soon as they get pest control in, we will definitely make sure to get them open as soon as possible, even if it was after hours or on a weekend. So I gave them my personal business card and let them know to call me, my personal.
Are they still closed?
They are no longer closed, so we were able to get them reopened. They're operating now. The most recent inspection actually showed that they dropped from 17 violations down to just 2. These are non-essential violations. We're going to allow them to operate without issue. So we got it addressed. The public is happy. We are happy. The business is happy. So that is the good news. The final thing I wanted to let you guys know is we are still in ongoing communications with state food safety, trying to get our food handler cards updated like we talked about last time. There's some back and forth information about what type they're going to allow us to offer in terms of statewide. So we definitely will be able to offer a statewide, but we just aren't sure what how many years that will be valid. So they're going to take a look. I already submitted the local ordinance from the Board of Health. They're going to take a look at it and then get back to us and let us know. But the goal is we should be able to start offering a statewide food handler card hopefully this month. So that's the goal. Questions for me?
The big one she removed, I think, was some of these superfluous numbers like pool inspections and things like that. There's so few pools in the county. There's really
Well, I actually
many.
didn't remove pool inspections.
You
I just
consolidated
combined
it,
them with
yes,
general
yeah.
sand because they're closer to a gen sand inspection anyway.
Right.
But the 12-month average on the original report was like 1. So I didn't think it needed its own box. This is just to simplify for you guys. Put it on one page.
Just
instead
for
of
that, you're
2.
gonna get 5 calls this month.
Yeah.
So, but yeah, again, like she said, feel free to, if there was a number on here where you was like, that is a number I really paid attention to. You have the side by side and you can see what was removed. If it was something you really want back on the report, we will do that. But this is part of our ongoing effort to streamline the board report around our activities so that you guys can actually have something digestible, something that actually is informative instead of just throwing numbers on a page saying we did all these little things. And this is, I think, what she's doing is I think gives a better, broader view for the board. So, but if you want anything changed back, we're happy to do so.
Maybe just one thing more of a question than anything. You mentioned like 117 or 107, not 107, that's from the food handler card, but
Yeah.
the site visits.
Yeah. So
That's, I'm guessing, a total of at least some of these columns.
Mhm.
Is it all the well and septic?
Yeah, so some of these are not on-site activities that the sanitarians are conducting. So like, you know, the numbers like from the food handler cards, I don't include those, as well as the septic, denial numbers and, whatnot. So what I could do is that number that is reported, I can create at the bottom like a total for you to make it easier to glance. And then I'll just run through it, and mention it.
Yeah, I think that, I mean, I like the sound of it. I don't know if it's necessary, but I think it could be helpful because I'm guessing it's the 43 plus.
Yeah,
13
yeah,
is
yeah.
28. So some of this stuff is you're on site at the facility or home. Some of this stuff is done internally.
Mhm.
Yeah, I'm just curious. Thank you.
I have a quick question. Just for information, on the septics, what would go into a septic permit denial?
So the septic permit denials, each septic site has to be evaluated, to make sure it's evaluated on terms of, they have to do a perk test. So it could be denied because the lot isn't within the West Virginia guidelines for a perk test.
Okay.
We also have to do an on-site evaluation. They dig us a 6-foot hole and we look at the soil. So the sanitarians actually go in the pit and they pick it and they look at the soil to make sure that there's no groundwater seasonal tables or heavy rock that would destroy a septic system. So the most common reason that we deny them at this health department is because of seasonal groundwater. So that would basically flood out your system and cause it to fail. These denials, while they look like there's a lot of denials, we are required to issue a denial letter in order to issue a class 2 permit. So when you see all these denials, yes, they're being denied, but that doesn't mean that that lot is done for. It just means that we had to issue that in order to move over to the class 2.
Can you explain 1 and 2?
Yeah, so we have 2 classes of septic systems. The class 1 is just your traditional septic tank in your drain field. The class 2 though it's an alternative. So it's a different solution for those lots that wouldn't have worked for the traditional septic and drain field. We have 2 types that we permit at the local level, pretty commonly. We permit a sand mound. So that's like where you actually create your system almost above ground. And then we also have what's called an LPP or a low pressurized system that uses pumps in order to do some stuff. I don't know. I would have to get the details on that for you guys.
That's helpful.
But yeah, so there's a couple different alternatives. And then we also have what's called a HAU, which doesn't use a drain field if there's low space on a lot.
And then slope effects.
Yeah.
Also, right, the
Correct.
alternatives, if you've got too steep a slope, they're not allowed. Right, so a lot of technical stuff.
Yeah, flooding, rock, if there's spacing issues, like if it's too close to a well or something, it has to be 100 feet from a well, it has to be 10 feet from other systems. So if you're on close lots, like for example, if you're in a subdivision, we still go out and evaluate those lots on a permit basis. And if there's a system that's installed on both sides and there's no way to fit one in, then we would deny that one as well. So
There are certain ones that get more complicated, that we would need the state to approve. The difficulty with that is they've got one person at the state who does that in Charleston, and that's far away. Come look at home. A regional sanitarian with that expertise would be very helpful because most of the building in the state is in the eastern panhandle. The regional sanitarian positions been vacant much of the last couple of years. There's not someone there. So that's one of our big needs from the state is to get that filled with somebody who's got some expertise in soils and science you need for that, the knowledge for that. And the types of alternative systems that are now available, things have changed in the last 40 years. So that's one thing we're kind of hoping for. That's very helpful.
Can I ask another question? this is not so much a year over year, or maybe a month over month question, but looking at vaccines for August and July. Is the August report, does it tend with back to school? Does it-
That's actually.
That's the next, that's the
Oh,
next
sorry.
report.
All right, well, I'm Lindsay.
There's your entree.
I'm Lindsay, I'm nurse director and psychiatric mental health nurse practitioner here. So I will go over the clinical report. Family planning, our numbers have picked up because Leah, our nurse practitioner for women's health, is back working with us. She's doing well. So that's why our numbers look good. And then to answer your question about vaccinations, yes, back to school, we see a surge in immunizations being offered for especially childhood vaccines. Flu season's coming up, COVID vaccines are now, a new one's coming out. So we're gonna see an tick in those two areas as we go into the winter season, that's expected. Everything else, we're pretty much on target where we expect it to be. Variations through the months happen, but nothing big to report. We had our office assistant she resigned, so we have now down one staff member up front, which also has been a part of our billing and medical side, so we're working on that. But we have a new position that will be open soon.
Today?
Today?
So
Okay, great.
apply now.
Hear that. But QRT, we don't really usually put numbers. Our QRT programs actually more busy. They're much more busy, working through with JCCM, and we're working with Eastern Regional Jail, and they have also working with our attorneys within our area. We've gotten a lot more calls, and we have clients going on, and we're doing really well. So
Quick explanation of the QRT.
Thank you.
QRT is the quick response team responding to overdose incidents in the county. We haven't still gotten there, we're responding to the actual overdose, but we're definitely helping other individuals who are seeking help or being referred to us one shape or form or the other. Any questions?
Do we have the flu or COVID vaccines for this season?
So, no, they haven't shifted yet. We're still waiting. COVID vaccines, we were told by mid to end September. So I'm waiting to hear any day now if when we're gonna get it. Flu vaccines, I believe we had one shipment in, but not all of them. So we have various types for the 55 years and older, and then regular, so.
And the COVID vaccine will be offering this year's the Novavax vaccine. Partly just not that necessarily one's better than the other, but stocking 3 different things for different ages. It was easier before when they were provided free, but now that we have to pay for them, have to bill for them and collect the money, these are tens of thousands of dollars worth of something.
What is
Yeah.
the actual cost of a COVID vaccine?
So I think she has the best idea. We don't know yet what the final number, but we do have a feel for it, somewhere around $100 a dose or something like
I
that.
think it's somewhere between 70 and 80.
70, it's a little less than my estimation. I always overestimate the costs.
Plus it's an administration fee.
Yes,
Yeah.
so, and that's billable, that is billable to most insurances, and so that's just another step for us, just like with the flu shot, to make sure that we bill it out right and get paid. Dr. Reedy was doing, mention what you showed me yesterday about the bar graphing you were doing.
Yeah.
Well, in your report.
Over the last 5 years, if we look at the reserve, the bank balance, it's dropped. We're just at about where we were. The big difference is the accounts receivable have gone from 80,000 to where they are now, 400,000 average. And a big part of that increase is the increase in private and state medical services provided. And a lot of that is the private vaccinations. Now, that doesn't take account of how much, so let's say it's $100,000. If $60,000 paid for the vaccine, then that's not really $100,000 revenue generated.
Correct.
So we gotta keep, and another big plan for this year is to be able to get more real-time data on where we stand on that and breaking it down to the individual insurer, so that we have to be cautious if there's some insurers that won't pay for certain vaccines. We need to know that up front, so a person that wants the vaccine, that they realize their insurance isn't gonna pay for it. If they want it, they'll have to pay for it. It's you don't get free vaccines for everyone. There are certain people who can get free vaccines through the Vaccine for Children Fund, but not everybody. We can't give it away. So what was happening 5 years ago was they were still doing the volume, but they weren't charging. Can't support having a staff with no income. Right, and you like to hear that stuff.
Yeah, yeah.
And we may need some technical assistance
Yeah,
in
that
figuring out.
really hit you up soon.
Okay, look forward to those conversations. Yeah, and you know, I was even gonna mention it during the August prelims, seeing the non-treasury AR over 100,000 again, and you know, 80 of it being over 180 days. I imagine that's commercial. Yeah, so it's tough.
It rings alarms,
Yeah.
doesn't it? When you see
Yeah.
that 180, me too, because you're getting to the point where they just won't pay.
Yeah.
Even if
And
you
is all that
file and
being-
say nope,
Is all that being tracked in QuickBooks
it is
now?
being tracked. It's being tracked in Office Ally in our EMR.
Yeah.
And then, and it's also being tracked in QuickBooks where it's been billed, but it still has an outstanding balance, and we do follow up as much as we can.
What's the
Not
other
always
tool
easy.
besides QuickBooks, the EMR?
Office Ally,
And that can spit out like 1500s and UBO4s
You got
for
it.
the commercial payers?
all of that, yep.
Okay.
Yeah, so.
Yeah, the
Everybody
more,
loves
the
it.
more you do to the commercial and, you know, the more challenging it gets to collect.
Correct.
And we hope to be expanding services,
Yeah.
with behavioral health and hepatitis C.
Have to get that.
Expand that service. It's, and not just to make money, but because the need is there.
Sure.
And, but as we do that, that challenge in getting the revenue is more important. Absolutely. And having a computer networking to do it is essential for us, because a person doing it adds so many opportunities for error.
Increase the IT automation whenever possible, and that's something we probably need a little bit on your expertise. What you think is some of the best training for our staff to get to become, proficient and competent
Mhm.
medical billers and things like that. So I'm sure you have some insight into that, so we'll get you up for that.
Yeah, I have some ideas. Looking
I
forward to it.
know you do. Sorry, Dr.
So,
Reed.
health officer, or sorry, are you done? Okay, thank you.
Quick question. How does the county do outreach to, for citizens about the availability of vaccines?
Inadequate. Mostly it's word of mouth. We have a website that is not as robust as it should be. And that needs to be improved. We do contact different groups about giving vaccines in businesses. Some other groups ask us to come. We get a lot of the childhood vaccines referred by school nurses or others. So we have a pretty close relationship with them. Hispanic community, good word of mouth, I guess, that we see a fair number of people who are new to the community that need vaccinations.
And we also try to attend any county events, and have outreach events and be present. That's one of the goals we always try to hit.
You guys were at the.
I saw
We
you
were
at
at
the
the
county
county
fair.
fair.
Yeah.
We were at the
I noticed
African
it
American
this year.
Heritage Festival. And
Health fair at
Yeah.
church next month, and then,
Social Religious
NAACP has
Ministry,
asked us to
also with
assist.
the Jefferson County Ministries.
Yes. Oh, yeah. Yep. So our, you want to talk a little bit about the vaccines with, Dr. Hemrick's?
So Dr. Humerick sees patients through JCCM, Jefferson County Community Ministries, and she partners with us with individuals who need certain vaccines if they can't provide it on site. So we try to, we're actually building that relationship where we can consistently be there and once a month provide vaccines. We just only had one time to do this yet. We're working on for next week. We have another appointment. But be able to take vaccines down there and have a mini clinic, but it's more targeted to her patients that she's already calculated and told us, okay, I need this many vaccines. So it's not open to anyone who walks through the door. It's pre-calculated who's gonna get what they're getting. So it's definitely helping that population because most of them don't have the ability to get transportation to the health department. We're not in a very convenient location, so.
We did run an ad in the Spirit of Jefferson for a month to 2 months, I think, last winter. I don't know how much business that generated. Thank you. We also offer travel clinic. So people who are traveling overseas who need vaccinations and advice, we do that. So we're registered as a young people vaccination center. Health officer report, most of it's been given. The big efforts right now, childhood vaccines out. Substance use disorder population is a big focus because there is monies available from these settlements that funds from pharmaceutical companies, and there are two funds. One is the funds already that have been distributed to the county, and the other fund is at the state level, the West Virginia First Foundation. And those are separate application processes that in the last week it has suddenly crunch time has changed, and that the county funds, we had to have our application in by November 2nd. That changed to October 1st last week.
Are you gonna make that, Owen?
Yes. And so we have had 2 meetings and have another one today with Jefferson Community Ministries about collaborating with them.
And then the Boise.
And the NAACP is going to be about a collaborative venture. And then the state one, I'm not sure we're going to be able to do anything because they announced at the last Thursday meeting, they announced and approved that they would distribute some funds for this calendar year. And they had a whole process for it, and they put the grant on their website Thursday evening. Those requests have to be in by October 3rd. And they divided, the state is divided into regions for that. And then there are, I think, 4 or 5 different categories. So each region is going to get money for each of those 4 or 5 different categories, and it will be given a regional basis. And we're not part of any regional discussion of what's going on. So this was try and see if we can get involved with somebody that may need it for next year's funds, so I think you need to get some funds out the door. But you can get $30,000 that funds something. So that's going to be a lot of our effort in this next 2 weeks.
Is that it? for you? You know,
So we met, Dan, I'm Gino Cisco, I'm the local health administrator. 1 is my official state title. So I explained where I came from, so we already discussed all that. But my report quickly, I know you guys wanted me to give you a quick idea of QRT expenses over the past fiscal year. So in fiscal year 24, we ran about $166,000 of total expenses through the QRT and staff time, staff effort, outreach efforts, outreach products, things like that. Of course, business cards, all those things, and a separate phone line that can be reached 24/7 by anybody who needs to these services. And we have someone who staffs that the entire time, carries it. One of our peer recovery support specialists carries that all the time, and she's always available, whichever one is that is in there. So that was all billable to the QRT grant. Those actually have all 3 of those quarters have been paid out, and we did incur another month in fiscal year 24 that I'm not able to bill until September 15th of this year. So we incurred 1/3 of a quarter, 1 month of a quarter in fiscal year 24. So that's probably about $15,000 to $20,000 in that we will not be reimbursed until fiscal year 25. So this is the
so we
whole,
can't book it
I
back.
can't do that. No, it's a quarterly payment and it'll pay out. I can't spread it out
So
that way.
theoretically, then really our deficit
It's like 10K.
is a little less than technically speaking.
Yeah, but I'm not going to play those games. I can swallow the $33,000 deficit. Again, I apologize for not running the clinic room upgrades past you guys. I should have definitely asked that we would have been more apprised of what could have the possible deficit that it would incur. So that won't happen again. I'll make sure that when we do that again, if we do that again, which I don't foresee, I'll make sure to come to you guys first before those contracts are signed. So the QRT has been great. You heard we have multiple people who've come through it. We've had people graduate from treatment and doing the really good things that we hoped we could do. And so that makes me very, very happy. Like we also said, that there's an office assistant 2 position that's our clinical front desk position that is open. That opened today. That'll be open for 10 days. If you have any friends, family, anybody might be interested in working at the health department in a role that is very forward facing, someone who is very customer service oriented, has a little bit of charisma and is very polite. That's what we're looking for. If you have some medical billing chops, that would be great. If you speak Spanish, that'd be even better. That makes it very narrow though. So those are the big ones. Financially, we're doing quite well with we have a good bit of money in the bank. We've been able to close the accounts receivable from the state of West Virginia. I've been pushing and prodding on them for 8 months straight, and they're catching up quickly. So good relationships with the grant people at down in Charleston has helped a lot. So send them some flowers and pizza once in a while, make sure that they know I'm paying attention to the good work that they do, and it's helped out a lot. So I don't really have anything else.
But quite well, you mean we're not in debt.
Yeah, we're not in debt. I did want to run this past you really quickly to the board, and the reason why is because we did have some changes in the budget. If you remember back in it doesn't let me do it. We discussed 2 different budgets. One was the budget without the increase in environmental fees, and one was the budget with the increase in environmental fees. So you had voted for both. So we are going to revert to the one with the increased environmental fees. You passed. Yeah, it did get passed by the county commission, and you voted on both. So I want to make sure that you understand. Originally, you had voted for what was roughly about a $20,000 deficit. With those increases in environmental fees, we're probably roughly expecting about a $3,000 to $5,000 surplus with those added in.
You're gonna let Charlie know, so that when she's in-
She is, and there was also an increase in state aid of about $8,000. At the same time, they reduced our threat preparedness grant by about $7,000. So it's a slight increase with the updated state aid, and I'll make sure you see that. I'll send that out in a separate email today. Evidently, they're not going to let me share this, so. But I'll send that out and you guys can see it in in an Excel file, unless you would prefer Google Sheets. So, I think everyone would prefer Excel, right?
Yeah.
So, we're good to go.
All right, excellent. Any questions for staff?
Good news.
Very good news.
All right, our next meeting is October 11 at 9 AM. So is there a motion to adjourn?
I move we adjourn.
Second.
Any discussion? All those in favor say aye. Aye. And Elliot raised his hand. We are adjourned. Thank you all.
Thank you.
Thank you.
Bye.
Thank you, Elliot. Thank you, Nathan.
Yep, see ya.